In January 2009, a delegation from Harvard School of Public Health visited Nigeria, Tanzania, and South Africa in order to explore the opportunity to create an African cohort initiative, together with African partner institutions. The purpose of the initiative is to create a unique cohort study of hundreds of thousands of people monitored over several decades in the 3 countries visited, and also in Uganda, visited the previous year. The primary focus will be on non-communicable chronic diseases, women's health, and environmental health, aspects of public health that deserve greater attention in Africa.
Our African Cohort initiative intends to enter new territory geographically and scientifically. And our goal is to enroll several 100,000 individuals from 3 or 4 African countries and to follow them over many years in order to better understand the causes of disease in this part of the world and also how it can be successfully prevented.
There are a number of reasons that it's important to support this initiative. The first is that we don't really understand the non-communicable disease burden in Africa currently. So we need to get information on what that is, what are local risk factors that are important in that region, to understand how to prevent these diseases in the future.
In Africa as a whole, there is a lack of experience in conducting cohort studies. There are very few and they're difficult to do. By engaging with Harvard in conducting such a study, we will bring new expertise to Africa.
The cohort is very, very important right now because we are now at a stage, especially in the urban areas, we have this epidemiologic transition whereby the lifestyle has changed and this has led to development of non-communicable diseases.
The cohort would provide an opportunity to examine important research questions pertaining to the prevention and management of these health problems, and will also provide us a platform for training the young professionals who would be the leaders of public health in tomorrow's world.
As a Nigerian student and as an African, I think the cohort study is essential to jumpstart research activity on the continent. I think it's going to be something that people will be able to build on, and it will amount to a transfer of expertise from here to Africa. And that is really, really important.
Okay, Yemi, show me your results.
So I had some trouble with the exclude macro.
Yeah.
And when I put in the macro and I put in exclude BMI.
Yemi here represents the next generation, the future of African scientists. And we want these African scientists and university faculty to have the very best training.
BMI is defined in the source file, the data.
The cohort is going to represent their training ground because here at Harvard School of Public Health, a lot of scientists have been trained on the cohorts that we sponsor here. And just like that, these cohorts will train the next generation of African scientists who will go on into the 21st century.
I think it can happen, and I think it is important for us to be able to do research in chronic diseases in Africa, especially as the incidence of chronic diseases is rising in the country and in the countries of Africa, and there's not enough research manpower to do it. And I think that is going to be important several years from now, and this is a long-sighted venture that should be undertaken at this time.
What would be the relevance for Africa to do this? The relevance would be that there are important research questions that we need to ask about disease in Africa, both infectious disease and also chronic disease. Particularly chronic disease because they are increasing in Africa at present, and we need to test methods of preventing chronic disease because treating chronic disease is very expensive, and prevention is much the best way to control chronic diseases.
What is it that you like to study among these people here?
Well, firstly, how we can have more supervised deliveries and how we can bring down mortality among children, but also the mortality among mothers that is very, very high here compared to the situation in Western countries. So this is really, on a global scale, one of the most important goals to achieve now.
So this is our data processing unit, where all the data which comes from the field is processed here.
How long would it typically take to survey 25 households?
We have a target of doing 40 households per week.
Per person.
Per person.
Per person.
Yeah. So they have an average of between 8 to 12. You know, some go up to 12 households per day.
The proposed cohort study that is proposed by Harvard is unique in that the populations that are going to be looked at are here in Africa. Many of the largest cohort studies internationally are either in the United States or in the United Kingdom or in Europe. But here we've got access to indigenous African populations, we've got Caucasian populations, and we also have mixed ancestry individuals. And each of those represents remarkable gene pools from all over the world, but most importantly, the oldest gene pools in the world are here in Africa.
Africa is going to see some major changes in the population and the way the transport systems work, the density of the population, the cooking styles, the types of fuels they use, the generation of electricity, water. It's going through this transition, which is going to have major impacts on environmental exposures to individuals over the next 20 or 30 years.
What's unique about this community? Why is it important to do a cohort study in Africa and in this community in particular?
I think one of the important things about a cohort study, firstly in Africa, is that we don't really have very many cohort studies in Africa. This is a unique opportunity to start something.
None of this size,
None of
to
this
my
size.
knowledge.
Absolutely. So that's certainly something that we can do.
Hi, Mrs. Lee. Hello. Your tablet's delivery. Mrs. Lee, what is this? Do you know this is this is actually messing up your health? This is a health risk.
When you're talking about the cigarettes now, I think I will rather smoke less because I know it's not healthy.
But I think, Mrs. Lee, so if I'm you, don't even think of smoking less. Rather throw it away, man, because this is very, very unhealthy to you.
Do you see the chronic diseases are increasing here?
Yes, it's increasing, and I'm doing deliveries. And from November up to now, January, I lost over 14 patients. I've got my book where I can show you. And most of my patients that died is heart diseases and diabetics.
Michelle, what are you going to do when you get back now? What is your next step, and how do we take this whole idea further?
Well, what I've been struck with in my looking at this problem is that there's been no money spent in this area. There's been a lot of money poured into infectious diseases, into the HIV problem, and that's a good thing. You know, the PEPFAR program and other programs, Bill Gates, take nothing away from that. That is all needed and should happen, but there has been no money put into chronic diseases, non-communicable diseases in Africa. And when we attempt to go back, and we're going to be writing a proposal and attempting to look for fundraisers who are interested in this new and emerging problem that people don't believe is happening in Africa, but I know you know it and I know it, and that's our plan.
I think this study is particularly important because it really allows the school to build on many years of research that has taken place within Africa, to build on relationships, but to conduct a project which is very different in scope and content than the kinds of work that we have done here in the past. And it really has the potential of helping large populations throughout Africa through discoveries that may be made through the study.
This visit to Africa has generated a quite long and concrete list of action items. So we need to work in parallel with preparing the study, with anchoring this study in the different institutions, involving Harvard School of Public Health, start thinking about different funding opportunities, and also think seriously about this initiative as a tool for academic development in African countries.
The Harvard School of Public Health has a long tradition of conducting large-scale cohort studies. It really almost started that discipline in its Department of Epidemiology through the Harvard Nurses Study and then other such cohort studies. Graduates of this school have led cohort studies which follow up a population over time in many countries of the world. So this is really one of the distinct research strengths of the Harvard School of Public Health. The cohort study will be both observational, it will allow us to understand how these diseases unfold over time, but it will also make it possible to test interventions, to actually design programs and test them scientifically so that we can learn whether they work or not work, and then that knowledge becomes disseminated and benefits the rest of the world as well. And lastly, I would like to see this as the beginning of a broadening of the global health agenda, but to begin to embrace also the emerging problems that are going to produce huge amounts of avoidable suffering unless we act today. These are preventable diseases. And if we act today by creating knowledge, by understanding and testing interventions, then I think we can look to a future where these will be manageable problems and not overwhelming problems that can thwart development in the poorest parts of the world.